New study says that it is raising concerns about expectant moms taking antidepressants.
But doctors caution there are many factors to consider. CBS 2's Dr. Max Gomez explains.
New data from researchers in Canada suggests the risk of autism nearly doubles for children whose mothers take antidepressants during pregnancy. The findings show the risk went up 87% in preschool children whose mothers took antidepressant drugs such as Prozac or Zoloft, but only if they took them in the second or third trimester. Still, the autism risk remains very low overall, between 1 and 2%.
That means that the chances of these women not having a child with autism were about 97–98%.
So even though the number doubled, the chances were good that that was not going to happen to them. Dr. Alan Manovitz is a psychiatrist who looked at the study.
People should not panic.
He says some studies have shown that antidepressants do not seem to cause major defects in babies, and that depression during pregnancy can interfere with a woman's ability to care for herself. She's at greater risk for using tobacco, alcohol, and other drugs that can harm her developing baby, not to mention increasing the risk for postpartum depression. So Manovitz says he will continue to prescribe antidepressants to pregnant women who need them.
Over the years, I've worked with many obstetricians, and we have to decide individually for each person what the risk-benefit ratio is.
Doctors emphasize the most important thing is to keep taking prescribed medications and consult your physician. Never stop taking antidepressants abruptly. And talk therapy and other non-drug options may be an alternative for certain patients. It's become clear that a number of factors contribute to autism: genetics, premature birth, depression by itself, and possibly exposure to antidepressant medication. In other words, it's a complex interaction of many risk factors that we're just beginning to understand. Dr. Max Gomez, CBS 2 News.
And researchers in the Canada study tracked more than 145,000 pregnancies for this study, which is published in JAMA Pediatrics.